No. Hello, I'm Dr. Sathish, specialist pediatrician working in eye care clinic under Emirates Group of Hospitals in IC Center. Today's topic is fever. Fever is the normal response of the body to a variety of conditions causing tissue damage, the most common of which is infection. Normally, heat is produced in the body and lost always. The production and loss are same. The body temperature is maintained at 36 to 37.5 degrees centigrade. When there is disturbance of the equilibrium, body temperature rise or fall. Body temperature is regulated by the anterior part of hypothalamus in the brain. The substance triggering fever are called pyrogens. Pyrogens can be exogenous like germs or endogenous like cytokines. These pyrogens produce prostaglandins which raise the set point of thermostat to a higher level. To reach this set point, the body start producing heat either by generating heat or preventing the loss. Vasoconstriction prevents the heat loss through the skin. Then the child feels cold and chills. If this measure is not enough to raise the temperature to the newly set point, the body start shivering to produce more heat. This results in rigors. Fever is defined as body temperature above 37.5 degrees centigrade. When the hypothalamus set point moves back by spontaneously or by medication, the reverse happens by vasodilation and sweating. Different types of fever are continuous fever where temperature rises above normal throughout the day and does not fluctuate more than 1 degree, like in pneumonia, meningitis, typhoid, urinary tract infection, etc. In remittent fever, temperature remains above normal but fluctuates more than 1 degree in 24 hours, like in infective endocarditis and brucellosis. Intermittent fever, temperature elevation only in certain period of the day, that is every 24 hourly in quotidian fever, 48 hourly in patient fever, 72 hourly in cotton fever. Fever is only a defense mechanism. It increases activity of leukocytes, enhance phagocytosis, decrease endotoxin effect and retards the growth and multiplication of bacteria. Disadvantage of fever are discomfort, increased metabolic rate, increased oxygen demand, and increased activity on cardiovascular and respiratory system. The heart rate increased by 10 and respiratory rate by 4 during fever. Fever is only a symptom, but most parents suspect that fever will melt their child's brain and cause fits. This fever phobia is baseless. If the temperature is less than 40 degree, no need of panicking. Keep the child hydrated and if needed, do tepid sponging by lukewarm water. If there is too much discomfort, you can try antipyretics like paracetamol or ibuprofen. It can be given alternatingly, but paracetamol should not be given more than 5 times in a day. If the fever is due to some viral illness, the interfebrile period will be normal and child will be active, and this fever will respond to antipyretics like paracetamol or ibuprofen. Parents should focus on the general well-being of the child. There is no evidence that fever will worsen the cause of the illness or produce any long-term neurological problems, even if the child gets simple febrile seizures. Consult the doctor if the child is below 3 months and the temperature is above 40 degrees centigrade. And if there is previous history of febrile seizure or any previous medical conditions of heart or neurological problems or lung problems, consult the doctor immediately. If the fever comes with a rash or the temperature is above 42 degrees centigrade or the child becomes drowsy and throws fits or the child is in severe pain, the parents should be always watchful and ready to act. Observe for any danger signs in the first 2 days. If the fever is persisting, consult the doctor and do necessary investigation to find out the cause of the fever and treat them. Nothing to worry. Thank you.